straight into immobilization, and it's just fantastic. Okay? So for side bending, you can go ahead and just scoot to the end. All right, so for side bending in the CT junction, you can just palpate, and I was just asking, where are you palpating just the spinous process, or are you palpating the inner spinous space? I like to palpate in the inner spinous space, but lateral to the spinous process, right? Because even with little tiny fingers, not that they're that tiny, but I'm sure if you're tiny, like they're tiny. But even with, just a little finger like this, I can still palpate both vertebrae when I'm lateral to the inner spinous space. And I like that because then I can see, what they're doing. So with side bending, with rotation, we're feeling for this of one spinous process on the other. For side bending, we're feeling for this. Okay, it's a simple little thing. Okay, so now realize that when I get down on this one, on rotation, I like to kind of start with rotating toward me and then continue rotating toward me. Side bending, I go the opposite side, because of the way that you have to do your hands later on. So you palpate, and then I'm going to side bend, have her sit real nice and tall. Okay. Okay. And again, usually approximately to T4, but maybe not. Okay? Like with her right now, I'm already wanting to put her hands up. So then what I do is I say, what I want you to do is I want you to put your hands behind your head again, and interlace your fingers. Okay? You guys okay with that? Got the picture up there? And then you grab the shoulder. Okay, now, believe it or not, this is not threatening. I have this hand, if you guys see her elbow over here, is on my shoulder. And then just make sure, this sounds silly, but kind of in line with Peter talking about palpation and not being creepy. Please don't be offended. Don't let your arm rest down like this, okay? Because some women, have equipment there. So, what you do is you come right in here, and then what I'm going to do, now, and I'm not pushing her like this. Okay, and I think that that's one thing that I see people do a lot of times is they'll want to push the patient and push this way. I really kind of keep her here and I keep this steady, and then I'm just pushing down here, okay, and then going as far as I can and feeling like I'm actually feeling something. And okay, and then when we get down here about T7, T8, then we've got to kind of change our position. So then what I do is I'm going to still have her in the same position, but now I come up and under here. You guys see that? Now this is the part that confuses people because they try and get their thumb all the way over here. I just put my thumb here, and then I've got this hand supporting here. Now I've got my shoulder here. I pull toward me with this arm, but lift with my body. Does that make sense? So I pull this way and then lift up, and then I can feel exactly what's happening at this segment with my thumb. And it's so nice. I love this one. Because then if I decide, oh, it's stiff, all I have to do is I can just sit here and just mobilize. Doesn't it feel good? Say yes. Okay. And then do the other side. Okay, so you guys practice side bending.